use 20% of the pool dollars in health insurance. Is that true?
Oh, no, it's false. It's the other.
No, it's true.
It's true.
No.
It's false.
It's false.
It's the other
So
way
it's
around.
20%.
Use 80.
That's
20% of the people use 80%.
That's why.
No, but I have it as 80% of the people. All right?
20%
The other
is
way around.
80%.
You just switched the numbers.
No, but I said it was false because it was the other.
Oh.
Yeah, most of the money goes to the elderly care. Okay? The cost shared by the beneficiary for any given medical service or procedure is called A, copay, B, deductible, C, premium, D, none of the above.
Copay.
The cost shared by the beneficiary for any given medical service or procedure is called copay. All right. Right. CHIPS is a safety net program for children. True or false?
Yes.
Okay. A method for reimbursement to providers that covers a set number of beneficiaries for a fee, regardless of how often they are treated, is called A, per diem, B, capitation, C, pay as you go, D, none of the above.
Capitation.
Capitation is correct. In other words, I'm going to pay you $10,000 for 100 employees, and whatever you do with them, you know, all you're going to get is 10,000. If you go over it, all you're going to get is 10,000. That's capitation. In other words, I pay you so much per head, not so much for procedures. All right. Pay as you go sounded good, though. A method of reimbursement based on similar diagnosis and treatment groups is called a symbiosis, B, per diem, C, DRGs, D, PDR.
DRG.
DRG is correct. What does DRG mean?
Diagnostic related.
Very good. Very good. My students are learning something. I'm just so proud.
Diagnostic.
A method of reimbursement based on similar diagnosis and treatment groups is called DRG. The most
Diagnose
common way
related.
to determine a country's health expenditure is to compare it to A, percent of GDP, percent of SGA, value of GPP, intensity of VGA. Which one is it?
GDP.
Percent of GDP. I think I made up the other ones. Terrible. But see, if you know the right one, you're not going to be confused, right?
Yes.
Cobra is A, a very dangerous snake.
Yes.
But that was a tricky one because it is true.
I
like
to
the
give
barbecue
you the
one.
obvious answer first. B, a carnival ride at the county fair.
Yes.
También.
C, an insurance between employment periods.
Yes.
D, legislation to provide continuous coverage.
Yes.
Yes.
Only C and D. E is only C and D. So
Only
both the last
C.
ones were
But
true.
they're all right.
Yes. C and D. Yes, they are all right, but the first two we did not cover in class.
Like the donut hole, like the
Dale con el
donut
barbecue. She's not going to forget that one.
With the donut hole,
Huh?
the donut hole where you put missing
Yeah.
piece of pastry, I
Well,
don't know.
it was. Isn't it? Anybody here ever eat donut holes? They're delicious, huh?
I love those.
Now, I know you're going to get that one right, the one about the, no. You're going to get the one right, the one that you're complaining about. All right, physician reimbursement. Physician reimbursement accounts for what percent of all healthcare spending? 50%, 40%, 30%, or 20%, or 15%?
20.
Physician reimbursement accounts for what percent of all healthcare spending?
20.
20. Why did you pick 20 of all those good numbers they give you?
No, because 20 is what I remember we read.
Because 20 is correct. Yes. An HMO is an example of managed care. True or false?
True.
True. The OECD exists for the purpose of
OECD.
OECD. You remember what that is? Organization of something countries.
Oh,
To bring them all
okay, the
together
33
to share
countries.
the stuff.
Yeah, there's 33 countries involved in this. Just remember that it's an organization of 33 countries. Exists for the purpose of A, promoting the marketing of health insurance in 32 countries.
Oh.
B, sharing the healthcare information and data among 32 countries to help each other. C, the eventual formation of a universal healthcare system. 4, all of the above. 5, none of the above. Which is it?
All of the above.
Is that a guess or do you know for a fact?
I think,
It's all of the
yeah,
above.
it's for a fact.
I'm sorry, it is not. It is B, sharing of healthcare information and data among the 32 countries to help each other. They're not promoting the market of health insurance in 32 countries. Sorry about that. Okay, at 16% of GDP, the USA spends more on healthcare than any other country. True or false?
True.
True.
True. Quality of service is directly related to the amount of healthcare spending. True or false?
False.
Very much false. With all the money we spend, boy, it would be nice to have better quality. The USA, what? Do you have a question over there?
About me.
The USA has done better than the other 31 countries in A, reduction of heart disease, B, reduction in diabetes, C, increase of cancer survival and screening, D, prevalence of obesity.
C.
C, increase of cancer survival. The Bismarck model of healthcare is characterized by A, the oldest health system model, B, every worker contributed according to their income, C, multiple systems funds were created, D, all of the above, E, none of the above.
All of the above.
All of the above. Okay, let me repeat what all of the above is. Characterized Bismarck, the oldest health system model, every worker contributed according to their income, and set up multiple system funds. All right. The Beveridge model was foremost in promoting public financing of healthcare for universal coverage. True or false?
True.
True.
The Beveridge model. Remember which one it was? It had nothing to do with beverages.
True.
True?
Yeah.
All right, it's true. Where was Beveridge at? Where did he set up the system? United Kingdom, in England. That's the system that still exists there. Okay, private health insurance, which is the USA model, is characterized by A, contributions by both employee and employer. B, spreading the risk. C, cost sharing with co-pays and deductibles. D, all of the above.
All of the above.
Very good. Medicare seems like a combination of the Beveridge and Bismarck models. True or false?
True.
Very true. Beveridge would have been happy with the Veterans Health Administration's health care plan. True or false? True.
Hold on. Sorry. Would have been happy with what?
Dr. Beveridge would have been happy with the Veterans Health Administration's health care plan. True. All right, the aging population features A, chronic diseases. The aging population features A, chronic diseases are a growing burden in all OECD, in other words, those 32 countries. B, often have multiple disease conditions. C, complicate the distribution of healthcare services. D, has increased by 36% in all the OECD countries. E, all of the above. Think.
All of the above?
All of the above. The easy way out, but it's also the right answer. All right, we have a little time. See if we can go through the last. This one should be very fresh in your mind because it's the last one we did.
If not, don't include that part.
Huh?
We don't make it.
That part.
All right, comparative effectiveness. CE, comparative effectiveness includes A, identifying the best and most cost-effective interventions. B, evaluating the best and most effective treatment. C, a more solid basis for reimbursement. D, all of the above. E, only A and B. Anybody?
Only, I don't know.
Comparative effectiveness. Think about comparative effectiveness. identifies the best, the most cost-effective interventions,
Yes.
evaluates the best, the most effective treatment,
Yes.
a more solid basis for reimbursement.
Yes.
So that'd be all of the above. Okay? Technology improvements are responsible for 50% of increase in healthcare costs. True or false?
Yeah.
True. The benefits of comparative effectiveness include A, quality improvement, B, diffusion of information, C, cost savings, D, all of the above, E, none of the above.
All of the above.
The benefits of comparative effectiveness includes quality improvement, diffusion of information, cost savings, all of the above. All right, companies dedicated to the research. Companies dedicated to do the research on comparative effectiveness and then sell the results to hospitals and insurers are known as A, CE researchers, B, data aggregators, C, health data subcontractors, D, none of the above. B is correct, data aggregators. That's all they do, aggregate data, right? Academic medical centers. Do you need a break for a few seconds? Anybody got finger cramps yet?
No.
All right. Let's see, where were we?
Academic medical centers.
Academic medical centers are partnerships between hospitals and medical schools. True or false?
True.
Very much so. Academic medical centers, partnerships between hospitals and medical schools. Surveys reveal that Americans, A, generally want the government to run healthcare, B, generally distrust government decisions on healthcare, C, are ambivalent about government control of healthcare, D, don't care what the government does about healthcare.
Distrust.
Distrust, B is correct. Obama's American Recovery and Reinvestment Act allows private citizens to reinvest in healthcare, provides money for comparative effectiveness research, has nothing to do with healthcare, only A and B. A allows private citizens to reinvest in healthcare, provides money for comparative effectiveness research, has nothing to do with healthcare, only A and B.
A and B.
It is not.
B
Only
for
A is only
research.
B, provides money for comparative effective research. It is a goal of the developed countries to ultimately establish a global health information sharing network. Is that true or false?
True.
It is true. Comparative effectiveness system is best run by a government agency, a private enterprise, or a quasi-governmental entity.
Quasi.
That is correct, a quasi-governmental entity. All right. Quasi-governmental means it's private and government combined. CER is an essential addition to healthcare systems because it results in incremental cost reductions, it reduces treatment variations, it produces improvements in public health, all of the above. Anybody know?
A.
Does anybody know what CER is?
Comparative effectiveness research.
Yes. It's an essential addition to healthcare systems because it results in incremental cost reductions,
Yeah.
it reduces treatment variations, it produces improvements in public health, all of the above.
All the above.
All right. All right, I'm not going to go through the matching because that one gets a little more complicated. I hope that you will do a good job with it. I chose, instead of having 20 matching, you're only going to have 10 matching. But if you remember the matching questions that I asked, 10 of them are here. All right, the new ACA healthcare law. The new ACA healthcare law will add how much to the healthcare rolls? 50 million, 45 million, 35 million, 37 million, none of the above. We're talking about people. We're talking about customers. The new healthcare law will add how many to healthcare roles? 50, 45, 35, or 37 million?
37?